I think it's really shocking that in the European Union today, 1 in 10 women don't have access to maternity care in the first months of pregnancy. I think it's also shocking that we see so many women in the Doctors of the World clinics who again don't have real access to health care, who have inadequate nutrition, particularly when we know what poor nutrition does to children. Look at the money we spend on that in our aid programs. And it's a particular issue for refugee and migrant women. Refugee women, we're seeing more of them coming into the European Union from particular countries at the moment. And they do have rights under EU law to maternity care, whether they're in the reception procedure and certainly when they have status. But we also know that it's a real problem in many of the camps, in many of the countries to which they are coming. And therefore we need to step up and fill that gap. We also know that for migrant women, the roughly 50% of migrants coming to the European Union are women, and that they also face challenges sometimes in accessing healthcare. That you see, for example, women who don't know how the healthcare system works, who fear really big bills or even deportation if their migration status is uncertain. And also look at what we say in some of our legislation about the need for comprehensive sickness insurance and the mess that that's currently creating in some of our member states. So we do need to improve what we're doing at the European Union level. After all our member states have signed up to the UN Convention on the Rights of the Child. We've signed up to the recent Sustainable Development Goals, which include goals on gender equality and on good health. So we know there are examples of good practice in the European Union. We need to make that the norm. And I also want to add a final word on statelessness, because a number of the children being born will be stateless. Their mothers cannot pass on their nationality when they're outside their country, for example. And if we don't sort that, we also make it much more difficult for mothers and children to access services. So we do need to make this a political priority within the European Union, that access to good maternal health care, access to antenatal and postnatal services are really important, and now is absolutely the time for action, and that's what I hope we'll get out of today's meeting and future developments.